Hi, everybody. The big takeaways from Chapter 2 on models and treatment are these. Models in the study of psychopathology should be seen as ways of explaining the cause of abnormal behavior. By the way, your introduction to psychology class, what we call models here may have been called theoretical perspectives in your introduction to psychology class. Now, this is important. We need and use all of these models in practice. The nature of the specific client's problem dictates the type of model we use for explanations and then for treatment. But put simply, how we explain the disorder predicts how we're going to treat the disorder. So let's go through each of these models and let's hit some of the high points and distinguishing characteristics of them. First of all, let's talk about the biological model, which is from the medical field, really a medical profession, like a medical model. The biological model assumes the existence of an underlying physical disorder, specifically structural or biochemical abnormalities in the brain, or less often genetic inheritance. This is responsible for symptoms of a psychological disorder. So the biological model is often referred to as someone having a chemical imbalance in the brain or some kind of brain dysfunction. The treatment goal here then is to relieve symptoms by eliminating or correcting or controlling the biological causes of the abnormal behavior. So as treatment, patients will take drugs like antidepressant medications, anti-anxiety medications, antipsychotic medications. Treatment by medication always comes first before any form of psychotherapy can begin, just to distinguish this model from some of the others. We want the patient's symptoms to be under some control, some calm, before we start the educational process that is psychotherapy. So the biological model almost always comes first. Then let's talk now about the psychodynamic model, which can often come much later in the treatment process. The psychodynamic model assumes the insight into lifelong patterns in one's own thoughts and emotions and motives and behavior and coping mechanisms. This insight will provide a true solution. Think, for example, like a long-term solution to a psychological or emotional or some kind of a relationship problem that a person is experiencing. With the psychodynamic model, the goal is to ask why a problem exists and seek a deep understanding of self, thoughts, and feelings, and thereby a long-term solution to whatever the recent problem was, the recent crisis. We often apply this model, the psychodynamic model, after a patient's crisis is over, and they are in a much more stable and reflective place, when the patient will often ask, why did this happen to me? This crisis, these symptoms, why me? The patient will often ask. And so they seek this deep understanding of self and thereby a long-term resolution to their recent problems. They want to reflect on this crisis, this recent crisis, now that they're feeling better, and make it into a learning experience. And that's when the psychodynamic model can be really useful. Let's talk about behaviorism, or the behavioral model, which is also known as the learning model. Behaviorism is basically based on learning. This assumes that abnormal behavior and the psychological disorders that we see are all learned through mechanisms of conditioning and association. Now that's from your Introduction to Psychology textbook on learning. That's classical conditioning, operant conditioning, and modeling, which is also called observational learning, the three ways of learning. Now the treatment goal with the behavioral model, or the learning model, the treatment goal is to apply these same principles of conditioning and association to reduce or eliminate maladaptive behavior, to reduce symptoms, to replace them with some more adaptive responses. Phobias and unhealthy habits and behaviors are often treated very quickly and very successfully applying this behavioral model. And the last one is the cognitive model, which is what it sounds like, the thinking model, cognitive model. This is a common approach for talk therapy that can last, months, with a patient sitting down with a therapist to examine their thoughts and feelings behind behaviors related to the recent event or crisis that brought them in for treatment. Now, this model assumes that symptoms, that maladaptive emotions, behaviors, result from irrational thoughts, beliefs, ideas. Thoughts drive feelings, and thoughts and feelings together drive behaviors. So this really traces back to the root of the behavioral symptoms, the problem that the patient's experiencing. It says some people will create irrational and negative assumptions and ideas about themselves, and these kinds of thoughts create problems in our perceptions of and our interactions with other people, and even in our own self-perception. And so these cognitions, these thoughts, cause problems in self-esteem and make it difficult to have healthy, fulfilling relationships with family and significant people in our lives. The treatment goal here with the cognitive model is to change any faulty, irrational, or negative thinking processes that may drive negative feelings and unhealthy behaviors, thereby addressing the root, the cognitive root, the psychological problem. So these 4 models of psychopathology are the ones that you should be the most familiar with. These are the ones most often used in understanding abnormal psychology and most often applied in the field of clinical psychology. So in summary, remember, just a few points, each of these models in the study of psychopathology should be seen as a way of explaining the cause of abnormal behavior. That's what a model is. That's what a theoretical perspective is. Ways of explaining the cause of abnormal behavior. The nature of a specific client's problems dictate the model that we will typically use in a specific case for explanation and for treatment. And then how you explain the disorder, of course, predicts how we treat the disorder. Those are the big takeaways from this chapter 2 on models and treatment. Thanks, everybody.